Hi everybody, this is John Marshall, and I think this will be my last installment for the year for the Medscape weblog. It's been quite a year for us in GI tract cancers, and I wanted to really refocus this one more time on the concept of individualized therapy. You know, in colon cancer, we finally got there. We've started talking about the EGFR pathway and the KRAS mutation and how do we figure out which patients will respond to which drugs. We see that in the world of new drug development, there's a lot more emphasis that's being shifted towards understanding the different genotypes and phenotypes, if you will, of the tumors themselves. And so that's all very, very good news. I think it will help us a lot as we battle cancer. But I also, at this sort of holiday time, want to also reflect on another important angle that I think we've frankly forgotten in this war on cancer, and that is the host response to the tumor. There's been, as of late, a series of articles, the most recent of which in the Journal of Clinical Oncology, which has looked at the host response to the tumor, if you will. They're measuring this by looking at the lymphocytic infiltrate around a tumor and actually looking specifically at what kinds of lymphocytes are going in there and attacking or interacting with the tumor. And what's interesting is that over a series of a bunch of different kinds of cancers, colon cancer, ovarian cancer, and others, they've been able to show that prognosis is really tightly linked to what kind of lymphocytic infiltrate is present at the tumor-host interface. And so, as a guy who spent a lot of his time looking at vaccines and immune-based therapies for the treatment of cancer, I'm a believer that immunology, that the immune system can play an important role. And now we're starting to see, based on these retrospective studies, some evidence that indeed we're right, that the innate host response can in fact dictate prognosis. And that if we can understand that host interface, we might be able to rev up the immune system or guide it further to help us in our attack against cancer. So we're spending a great deal of effort, a great deal of energy on understanding the tumor and the differences that one patient's tumor has from another patient's tumor, which helps us select drugs. I think that's very important and should be an appropriate focus for us. But we cannot forget the other side of this puzzle, and that is, what's the patient doing? What is the host doing to try and fight off that tumor as well? And I think between the two of those, we'll really get there. We will make dramatic positive moves in the future. But one other piece, I actually wonder if the host response might end up being the more valuable one. If you think about the cancer is always evolving and mutation rates are high, and all it takes is one cell to be broken, and then there you go, you've got metastatic incurable cancer. Whereas the host immune response actually is not that much subject to change. It is going to evolve, but not evolve to be ineffective. It's going to stay there and be active for us. So it may be that the host immune response is the easier thing in the end to figure out and control. So in this war on cancer, remember there are two fronts. There is the cancer itself. Understanding the enemy is important, but we also have to be reflective about ourselves, about our own response to the cancer. And I believe that if we focus on both of those, our ends will be much greater. Everyone have a good holiday season. I'll see you next year.